My name is Carrie Carda. I am an obstetrician gynecologist. I've been practicing in Poplar Bluff, Missouri for about 20 years. Right, I do obstetrics and gynecology. I also have shifted my practice over about the last 10 years to more metabolic and nutritional medicine. Yes, absolutely. I've been treating patients, as I said, for about 20 years, and what I noticed was they just weren't getting better. I was fixing some things, but not overall able to, as a whole, get them well. And I began to realize that this was probably due to their nutritional statuses, to some of their intolerances that they must have, a lot of gut issues that I just couldn't seem to figure out. Yes, I did. I have been doing the ALCAT test now for about 3 years, and I initially did the study on myself, and it had such a profound impact on my own nutritional and health status. I then moved it to my family, and it was just life-changing for myself and my family. And so I began to put it into my practice, and every day, it is the piece that I was missing in metabolic and functional medicine. Well, again, being an obstetrician gynecologist, of course, hormones were a big issue, and making sure people had energy with their adrenal glands, but getting people well is healing the gut. You know, the gut is the second brain. The gut is where you don't feel well unless your gut feels well. Again, what I found is if you don't identify what is causing all the gut problems, which I just could not do until I found the ALCAT, I wasn't able to eliminate that from the diet, eliminate that from their life, and heal the gut. What I've noticed when I've introduced the ALCAT, within just days, really days, certainly weeks, and again, it's long-lasting, but they get better. They get better almost immediately. I know I certainly found that personally, as well as in changing my family's diet. What I have found in my practice is that very common, there are some main food intolerances and allergies that are very common, that lots of people have and they're very unaware of. They don't even know those things are in their diet. So again, I'm able to piece that out with the ALCAT and explain to them and show them and teach them what they need to pull out of their diet. I have taken gluten out of some of my patients' diets that was on their severe intolerance list, and they have lost 10, 20, even 30 pounds in a very short time, just weeks. Most notably allergies, itching, skin allergies, sinusitis type symptoms, they're just gone. I mean, literally gone. What the patient seems almost overnight in pulling those foods out. What I noticed in my practice is when I introduced the ALCAT into my practice, I was able to help patients that had seen numerous doctors. I have tried numerous things with them, and it was only until I brought in the ALCAT, realized what their bodies couldn't tolerate, cleaned up the gut, did they really start getting benefit. There's no doubt in my mind that standard of care will eventually require that these tests are done, because it's the only way to figure out what you're intolerant to. I've tried great lengths to do elimination diets, and they're hard, they're difficult, the compliance is poor. What I have found is just simple blood testing is so easy, and you get all your results back, they're accurate, it's right there in front of you, you can educate your patient and lead them in the exact path that they need to go. I practice in Poplar Bluff, Missouri. If someone would like to find out more about the ALCAT or have any questions or they can email me at ccobgyn@gmail.com. They can contact my office at 573-776-7393. I would be happy for any clinician or patient to contact me. I 100% believe until you change the diet, until you figure out how to clean up the gut, you're never going to have overall total health and wellness, and the ALCAT's the way to do it.